Welcome back to the Island Docs. We've just heard from our expert on breast cancer. Now we're going to answer some questions that are frequently asked during breast clinic. You know, what are the concerns of the ladies during breast clinic, right, Dr. Gordon?
Correct.
So one of the questions that you probably hear a lot is, when you have breast cancer and you do surgery and it gets exposed to the air, does that cause it to spread more?
Well, this is something that I would like to address because a lot of women believe that if they have a breast cancer and a doctor performs any procedure on it and cuts it and it gets exposed to the air, then it causes it to spread. Now, I have to say that this is absolutely not true. Now, sometimes if by the time the lady presents to us and the breast cancer is there and we try to intervene by performing a surgical procedure, then sometimes it has already spread. It's not the fact that we are doing any cutting that causes it to spread, but we have been trying to do it after the fact and it has already spread.
So when you get in there, you realize that it has already spread, and then you have to come back and give this news or information to her who thought that it was only in her breast. What about mammograms? Does that increase your risk for breast cancer?
No, that's another thing. I have patients who come in and they're afraid that the mammogram is going to show something or the mammogram causes breast cancer. They come and they say, you know what, doc? I was fine all the time. I was happy. You went and you did a mammogram and the mammogram caused the breast cancer. Well, I have to say, well, no, that's not it. The mammogram actually detected the breast cancer and we were able to find it and treat it early.
Yeah, mammograms are actually a way of detection for breast cancer, not a causative agent.
Right.
So what about, you know, if you just simply ignore it, leave it alone, it will go away on its own?
That's another thing that, I mean, women, if you have a lump, I beg you, please go get it tested, go get it checked out. Have it checked out by a medical professional. And I would like to also speak to my colleagues. Breast lumps in women are things that need to be investigated. I mean, I have seen in many cases where women over 40 or women under 40 have had breast lumps, and they've gone and seen doctors who have told them if it's an abscess, they treat it with antibiotics, or if it's a lump, they tell them it's nothing, they might do a biopsy and turn these women away. And years later, it comes back that those same lumps are in fact breast cancer.
So what you're saying, any suspicious lump, what we should be doing is getting that lump checked out.
You need to get that lump checked out, and doctors, you need to do a step further and send that patient for further testing. Send that patient for a mammogram, send that patient for an ultrasound, and send that patient for a biopsy.
Definitely. So what about, you know, alkaline water being used as a treatment for breast cancer?
No, I mean, in the Caribbean, a lot of people try different methods of treatment, and there's this thing that alkaline water can treat breast cancer, but I have to say that is a myth.
So what about, you know, one of the treatments for breast cancer is in fact, like, you know, having chemotherapy. I know it brings about a lot of apprehension, you know, you're worried about it. You know, you've heard chemotherapy makes you sick.
Now, chemotherapy has a really bad rep, and not without good merit. I mean, some women feel really sick with chemotherapy, but that is not the rule. I mean, some women actually feel okay. Some women, after they go through their chemotherapy regimen, they actually do well and get over it really well without actually being that sick.
And stuff?
Yes, it's like pregnancy. Some women go through pregnancy and they feel really awful, and some women go through pregnancy and feel really bad. Even the same woman who have multiple children, the first child might not give her any problems, the second child might be terrible, and the third child might be fine.
But what about your hair loss?
Oh yes, hair loss. Now, hair loss is a big thing because women...
I mean, I understand, because, you know, so much of your beauty is attached to your hair, and I mean, you don't want to lose your beauty. You know, you're afraid you might lose your husband, you might lose your boyfriend, you might lose your significant other. You know, people might look at you funny. So I could see where the apprehension comes with chemotherapy and hair loss. So what about that?
Yeah, I mean, chemotherapy can cause quite a bit of hair loss. And, you know, there are a lot of women who do suffer hair loss. But I have to say, it doesn't happen to everyone. I've had patients who come and tell me, you know what, my hair actually grew on chemotherapy, which I found was actually fascinating. So the point is, each person is different. So you can't take the experience of one person of what you hear, because sometimes they sit in the waiting room and they discuss things among themselves,
Well, obviously,
and then one
naturally.
person gets one idea in their head, and then they come and they share it with me, and we have to say, no, that person's experience is different from yours. That patient will lose all their hair because of chemotherapy, but you may not.
So it's an individual basis. It's something that is, on a one-on-one level. We're going to take a break now, but when we come back, we will discuss other breast issues and recap the show. So definitely stay tuned.